Good evening, everyone, and welcome to our fourth Youth Charcha session, an online forum by youth for hosting webinars with leaders, entrepreneurs, and young professionals, fostering open conversations on the latest developments in digital health. Today's webinar on overcoming obstacles in implementing AI solutions for healthcare, reaching the last mile, is presented in collaboration with PhixAi, an initiative aimed at accelerating innovations in artificial intelligence to sustainably accomplish the goal of universal health coverage. I'm hoping many of you who have joined our session today are youth members and are aware of the youth community. For all of you who are new to the community, I'd like to take a quick moment to tell you a bit more about our platform. So YODH, which stands for Youth Ownership of Digital Health, is a volunteer-led community of digital health professionals of 35 years of age and under who aspire to be the next generation of leaders driving change in the digital health space. The vision is to empower young professionals in the digital health sector, to lead the community, provide them with increased representation, knowledge, and networks. We are now a community of 600 members strong across 20 countries and in over 70 cities. If you're not a member of our community, then just head over to our website and you can register with us. We're also sharing a link in our chat, so you can always, go to that link as well. So when our team was putting together the panel for this session, we were very, very excited as we are joined by a very eminent cohort of panelists who have had much to accomplish in the field of AI and emerging technologies at a very, very young age. We first have with us Tanvi Lall. Tanvi is a director of strategy at People+AI, a non-for-profit working to create social impact by demonstrating and disseminating population scale use cases for AI in India and helping people reach their potential. With over 10 plus years of experience, Tanvi's work is centered around developing innovative, patient-centric healthcare products and services that can be used in emerging and developed markets. Thank you so much, Tanvi, for joining us and welcome. We now have with us Jibu Elias. Jibu is an AI ethicist, activist, and researcher with a very diverse portfolio of roles. Jibu serves as a research and content lead at India AI, a government initiative under the purview of Government of India, and the Responsible Computing Challenge lead for India at Mozilla. Jibu, once again, thank you so much to you as well, and thank you for joining us. We also have with us Resham Sethi. Resham is our moderator for today's session, and she is a senior program officer at PASS and also the lead for PhixAi. A very, very warm welcome to all of you. And we really look forward to our conversation with you guys today. For all our panelists, for all our participants, in case you have any questions for our panelists through the session, please feel free to use the Q&A function to post your questions, and we'll try our level best to take up as many questions as possible towards the end of the webinar. I'm now going to go off the screen and hand it over to you, Resham. Over to you guys.
Thank you so much, Pallavi, for bringing this together, and Sarah as well. Hi, Jibu. Hi, Tanvi. It's an absolute pleasure to share this space with you both. And thank you for all the participants as well. I'd like to actually start with kind of diving a little bit deeper into the regulatory challenges and identifying common obstacles that organizations or individuals and governments face in terms of employing and scaling AI solutions, specifically for health. So navigating the intricate landscapes of regulatory challenges, especially in the realm of AI, is quite a course through uncharted waters, according to me. So Tanvi, my first question to you is, at People+AI, you're implementing several projects. So can you please tell us about what are the regulatory and ethical compliance challenges that you're encompassing in employing, deploying, and scaling AI solutions? Maybe an example that focused on health or beyond would be helpful.
Yeah, sure. So see, at People+AI, we are very much an enabler of the AI ecosystem. So by the nature of that, we end up working with startups who are, again, innovating tools for health, and specifically digital tools enabled by AI. So, I mean, common challenges we come across, right, are the fact that, when you're using LLMs and data sets, and specifically the need becomes when you're making tools for India, you want to make tools which are multilingual in diverse Indian languages. The question becomes, firstly, do we have large language models today that are trained in these diverse data sets? Do we even have data sets? And then if you have these data sets available, where is this data coming from, right? Like, what are these tools, what are these models actually trained on? So a lot of the times we've heard that startup founders typically struggle, firstly, with finding these data sets and the large, and figuring out the exact models that would enable them to make a tool that will actually cater to the Indian landscape, right? And then the second is, if you are making a tool in the health space, see, health is a high burden space, right? So not only does your tool have to be very good in terms of its accuracy and safety and efficacy, but also when you are making an AI tool, typically healthcare settings and customers ask you high burden questions. So they'll ask you about, okay, if I am giving you my data, where is it going to be stored, right? How are you going to use it? So the regulation challenges are on both aspects. One is, how do I make a tool? And secondly, if I made a tool, how do I design a go-to-market and a regulation strategy where customers actually believe that this tool is just not going to run away with my data? So things like data privacy, consent, transparency in what the tool has been trained on. These are very important aspects that AI builders and startups have to think through, and they often struggle because they don't find a lot of literature out there on what does it take to be compliant, right, in this ecosystem, specifically in the health space, which is anyway high burden.
Very interesting. Thank you so much, Tanvi. And drawing more on the Indian landscape as well as lack of data sets and also lack of trained data sets, Jibu, I'd like to ask you, so your work has centered around the construction of a unified AI ecosystem in India while you were at India AI, and also development of inclusive AI ethics and governance guidelines. So, according to you, what are the regulatory and ethical compliances that should be in place and should be integrated within the unified AI ecosystem? And also, not just the problems that exist, but according to you, what are the strategic pathways to solve this challenge?
Yes, thank you, Resham. When I was with India AI, we looked mostly into building a unified AI ecosystem as well as the other aspects. But in my recent work focuses around, how do I say, I joined the dark side or to the other side. I'm more and more concerned about the way things progressing, especially, there's a whole bunch of I know a lot of Indian startups are doing phenomenal work in space of healthcare, and People Plus AI is doing phenomenal work. Vadwani is doing an amazing work, and Nirama is there, Cure AI is there. They are all doing brilliant work, admirable work. YO.DH, all those startups are doing phenomenal work. But at the same time, we are seeing this problem of all this. How do I say, snake oil salesman, right? AI has become such a buzzword. Anyone and everyone is using that word to enter into any space. Now, the thing about the startup mindset, or what I have coined, the Silicon Valley law of ethics, is that move fast, break things, right? But that how do I say, that train stops at two sectors, industries. One is healthcare and one is finance, right? There are so many reasons, right? So, for example, it's not easy to navigate the global regulatory landscape at this point, right? Like, for example, GDPR is there in Europe, and in US you have HIPAA, HIPAA, Health Insurance Portability and Accountability Act. It goes long back to 1996, right? And even in India, even though we don't have any specific healthcare regulation in terms of AI, I think organizations like ICMR has taken, commendable measures in coming up with guidelines. I think they have came up with an ethical guideline, right, which focus on AI applications in healthcare in India must navigate this both national regulations, whatever we have in healthcare, as well as guidelines from bodies like ICMR and all. And one of the key component of these guidelines is that every patient must have the complete autonomy to choose or reject AI technology, right? We can't just jump into and saying everything AI is going to work out. Every AI is not created equally. That's another thing. I think the time we touched upon the data set part. So that's one thing, right? And there should be an effective transparent monitoring of human values, and the moral consideration of all stages of AI development and deployment, especially in healthcare, right? So the patient or the participant must have a right to refuse consent. So that's my theory. You can't impose upon any tool, right, without their consent. Now, coming to the that's one overall question here. Coming to the case of data set, I think yeah. Let's look at the other side. That's been the biggest challenge we have, right? I mean, I think there is this issue where a hospital in Maharashtra has been taking the weight of newborns, and that's the weight remains same for many years. Every newborn has the same weight every year, whether it doesn't matter, it's a different parent. Why the nurses were not keen on noting that data? Because they didn't understand the value of collecting that data. And we, unfortunately, as a country, as a community, we have a very bad habit of data collection and documentation. And these things came really into light. For example, there was this project by IIT Hyderabad during the COVID times. It was a phenomenal project they worked on. It was a morbidity predictor system. They could, if somebody is diagnosed with COVID, and it could predict kind of where they will, how high or low their condition will go in the next 12 days. Unfortunately, we couldn't use that program because it was all trained on Wuhan data set. And when they looked in any Indian data set, there was no such data set was available. All they got was around 100 or something data sets from Max Hospital, Delhi. The developers told me. So that's a big challenge, right? This landscape. So I mean, we need regulation. I mean, we can't do without regulation. But at the same time, we can only be comfortable in allowing, let's say, we can, overcoming this regulated landscape only if we can make 100% sure that these developers or who are deploying has some sort of code of ethics or moral values when they do that.
Thanks, Jibu. I think I come from a research space, and when you talk of data collection, that is something that's really important because it is like a foundational blocks to develop data infrastructure and then move towards building robust AI systems. So my next topic is on data quality and accessibility. So, Jibu, when, of course, in your current role as well as in your previous role, did you kind of integrate or address, or let's say, ask important questions on how do we integrate strategies for data collection in underserved areas in India? Or how do we address the data silos and the interoperability issue? Whatever.
Interoperability. Yeah, I also get that word.
Yeah.
It's a
Issues
tricky one.
that exist in our country, especially because we have such massive disparities, and there are remote areas where there is no access to public infrastructure as well. So, did you kind of integrate these kind of strategies within your work?
When the beauty of AI in healthcare, personally, what I believe is its ability to improve accessibility, access, right? Let's say somebody living in rural Karnataka, or let's say somebody living in Narayanpur in Chhattisgarh, right? What kind of access do they have for a proper something we city folks take for granted for a cataract surgery, right? What kind of access they have? Because if you look at the numbers in India, there is only one eye doctor. I don't want to mess up ophthalmology. So there is only one eye doctor for every 250,000 people in India. And the density or that ratio reduces, right? So that's when when the Tamil Nadu government developed that tool called eParve, which is a font-based tool that can analyze cataract, or the work that Google, Microsoft, all these guys have done with Aravind Hospital, Shankar Nethralaya and Prasad Hospital, all these guys about on diabetic retinopathy and all these sort of a preventable blindness situation. That's where I feel the real magic in AI is, that sometimes you don't need an expert doctor to diagnose something, right? Something like diabetic retinopathy or cataract can be assessed through the image, right? The picture of the fundus is more than enough to recognize it. And that can be done by training the local level health workers. So that's where the magic is, right? This local level health workers is getting a magic wand. It could be an app on their phone or a tool they have. That's the same strategy Nirmay has done, right? Nirmay has created a non-invasive breast cancer diagnostic system. So this is where the magic lies. Now, the challenge is, yes, there are two challenges. First of all, the research, the real research that's happening in India in healthcare often fails to translate into product. That's a big challenge. Secondly, the question of data. Now, why the problem with research happens is that, I mean, I think I will get that into another, I think later on, but with the data set, we keep saying, we are data rich and technologically poor. Every department, every government department is sitting on silos of data, right? If you go and everyone wants to create this data sharing system, right? We have an open data.gov system. Unfortunately, where data sets were listed in PDF, skewed PDFs. Unfortunately, I don't know how that's going to be useful. Every state tried to create data system. Maharashtra has a data sharing platform which is still beta in last 5 years. Telangana has a comparatively working data sharing platform. Tamil Nadu has one. So that everybody's creating this system. So I think that's where the proposal for a data sharing platform by MeitY becomes very significant, right? The idea was to build an India Data Management Office, IDMO, under the MeitY, and IDMO will take in requests from Indian researchers, Indian entrepreneurs, and Indian academicians, right? For the data set, they will go through the research, then they will connect with the appropriate department, compile the data set, make it machine readable, and then provide them, right? So this was a phenomenal idea, and I think this was very largely deliberated. There were a few stakeholder consultations. Even we have a white paper on that. So that's a one very how do you say, very impressive way of solving this data problem. Another one is something we have been working for a while, right? The National Digital Health Mission, or now what we call Ayush Digital Health Mission. It has some brilliant ideas, right? I think some of these ideas, for example, using a token system to access health data of the patient, right? And all those things. And how can you collate all this data for a platform? They also kind of worked at some phases of the pilot, and these ideas, they're all good in terms of ideas, right? And so that's the biggest challenges we have. But more importantly, healthcare data is very sensitive, whether it's the government is accessing it, or it's Google is accessing it, or Microsoft accessing it, any entity, right? Even if it's an IIT. So that raises a lot of risk and a lot of accountability regarding how these data sets are collected, how these data sets are used, and most importantly, how they are anonymized, right? That's something we often miss. We speak about accountability, how to anonymize these data sets. So that still lies a challenge, and I think maybe a project, some ways in which we can solve. Another maybe a good example is to look at the project called YO.DH. That was for a smart city project created by IISc Bangalore, where they created a data pipeline, right? It acts like a data exchange sort of, but then again, the risk and the safety concerns of health data makes it also a little more complicated.
Thanks, Jibu. Tanvi, what about you? Are you facing similar issues at People Plus AI? If yes, how are you addressing these data quality issues and accessibility issues? And also, if you're also having projects that get into creating data sets, like starting from scratch. So if you could throw some light on that, please.
Yeah, I mean, we often debate is, we are looking at community health projects, right? We take a very bottoms up approach to what we are focusing on and what we are building technology for. One of the areas in healthcare in India that we're very interested in is frontline health workers, and how can AI help them in day-to-day operations, improving productivity, improving training for them, right? And see, any aspect, I mean, of health that you pick up, where you need a good AI tool, you have to think through what kind of training data or what kind of data should that tool be trained on. And what we've come up with is a few things that you should consider, because data is not purely data collection, right? It's all about data handling. Like, how do you anonymize it? How do you clean it up? Like you said, how do you store it? And there are various aspects, not just the fact that you get consent and you get data from someone. So a few things that we have considered as we have even thought through what would it take to build a well-curated data set is, I'll list out a few things, right? So the first thing is like privacy policy, right? When you are collecting data, you should be very clear as a collector. What are your best practices? Who are going to be the users? What are the limitations? You have to think through these things because, and all the steps I'm outlining give confidence to the person you're collecting data from, right? And these are just things, not even nice to have things. And at this stage, these are must-have things that you should have thought about if you are a data set curator. The second thing is like, what's the purpose for the data collection, right? Because you have to understand that the person who's giving data should understand like what are the ultimate business objectives where my data is going to be used. And you should also be focused on what data you want to collect. You're not just collecting data for the sake of collecting data. It has to be tied to a particular objective. The third thing we really encourage people to think through is consent management, right? So how do you obtain informed consent from a person you're collecting data from such that the person actually understands consent? It's not purely like a checklist, right? You're just not signing a form and saying TNC apply, my data has gone somewhere. You should really understand, especially when you talk about these underserved populations, right? Who are potentially at risk because there's a language barrier or there's an education barrier. Other thing is grievance redressal. See, one thing is you've collected the data and you've curated a data set, you've collected it from someone, but you also have to give confidence to the person you're collecting this from that less. In case something goes wrong or you have a question tomorrow, or where has my data, figure out again where is that data ultimately, what has it contributed to? So that again is another part of it. And then one thing that I would encourage ABDM and maybe other government bodies to think about is, can we standardize how we store data? See, note formats and specific ways, like what are we capturing, in terms of when it comes to health data. Currently, we don't really have a benchmark or a standard, right? If you define that in itself will give confidence to the people you're collecting it from, that listen, these are the 3 things they want from me. It's not like 1,500 things, who are thinking about data sets and creating some of these for industry, as they're curating. I think Jibu has a question. I'm not sure what.
Not a question. I just want to add to something we just mentioned. So there is this figure. I want to give you 2 figures. One is that inaccurate data costs around $3 trillion annually to the US economy. That's a huge number, right? Overall. Now, when you come to India, the biggest challenge I think we often mention is that only 5 to 10% of our health data is even digital, right? So we can speak about taking consent. We can speak about even now, if I go to one of the best hospital in the state of Kerala, I go there, I give my phone number, they give me a file, right? Still with scribbles of doctor. So it has to start from that phase, whatever we are trying to do.
I mean, also to add to this, right? If you see the startups today in the health AI space in India, if you look at their workflow, what is their tool doing? The first thing they start with is digitization. It could be a prescription, it could be a diagnostic report. But the first thing they're trying to say is this data needs to be digitized so that I can again use it for various purposes. And then a common question we ask them is there a data standard you're abiding by, right? And they come back with saying, is there a data standard we should use? So it's a chicken and egg thing, but also it all starts there. It starts with the data getting digitized, and then how do you store it, what formats, etc.
Thank you. It reminds me of, so I was working with one of the state governments, and they wanted me to integrate certain AI systems in the de-addiction and rehabilitation centers across the state. So I said, okay, sounds interesting. So I said, okay, let me visit the de-addiction and rehabilitation centers. And I realized that they have cupboards and cupboards of paper registers or log registers. There is no information systems, there's nothing, or there's no D of digital infrastructure there. And they're talking in terms of getting in, integrating AI systems or doing some predictive analysis. So I was like, आप पहले computer तो ले आओ यहाँ पे. Start from the basics. So, Tanvi, you spoke on bottoms up approach and also focusing on healthcare workers. And I'd like to kind of speak on or ask you all about value-based systems in terms of building trust and acceptance. So, Tanvi, one of your initiatives at People Plus AI has been on community health series, which I found very interesting. So it aims to support stakeholders to develop AI solutions in the public health domain. So can you please educate us a bit more about the initiative and if and how you are attempting to build trust and acceptance amongst the communities through this initiative?
Yeah, sure. So see, we are trying to do two things. One is we are trying to create spaces, trusted, very informal spaces where like-minded individuals who are either from a not-for-profit space, builder space, policy space can firstly just come and meet and exchange ideas. Because we feel a lot of good dialogue just happens. So this is not an event where a person comes to pitch to an investor, but here, let's say a pre-startup or an early startup company comes with an idea where maybe they're developing an MVP and tries to get feedback on if I'm doing this, am I doing this well? Have you done this before? Have you innovated before in this space? And if you did, what were your best practices? Because similar to what you guys are doing here, there are limited spaces, right, for places where people can exchange ideas. The second thing, that we are trying to do in the frontline health worker space, and this is really the beauty of AI. You brought out a very good example of manual registers, right? And typically that's the way the country runs. And you would logically think that the answer here is to buy a computer and to feed information there. But today with AI, even with the GPT-4, you can open up that app, take a photograph of the register, and it will synthesize, analyze that information and give you an output, which is digitized. So the beauty of AI is that you don't really have to change your practices. It integrates in your practices and gives you that. And basically AI today should be shaped for humanity, not the other way around, right? You should not be asked to change your daily operations because you would think that the logical step is to first digitize, right? So we are really doing two things. One is, creating these community meetup spaces. And the second is that for frontline health workers specifically, we are working with organizations in the field. So two pieces that we do there are we release knowledge pieces, and these are typically blogs, which have been curated, and we go to, again, people who are serving these markets. So someone said Cure.ai. Cure.ai is a great example, right? Very, very decentralized approach to how they've created their solution and deployed it in some of the most remote parts of India. Just a second. Give me a second. Sorry. So the first thing that we do is release knowledge pieces, and we try to get leaders, from organizations like yourself, other not-for-profits, but also actual builders who have not only built a solution but scaled it, to some level, because these are the people who really have insights on how do you do it, and they're more than happy to share it with the community, is what we have realized. This is not a state secret. So that's the first piece. And the second is, we're trying to identify themes which are very problematic for these frontline health workers. So a few themes that have emerged are productivity, right? And how do these people, how do they currently use the apps that are available to them? Or how do they currently train, patients? Let's say you're in a village and you're with an Anganwadi worker. How do they go and educate the citizen on the other end? And improving their productivity, because we realize that a lot of the time, 40% of the time or so is just going into repeating that same information again and again. and giving awareness. So you would think that because of this highly constrained resource, maybe we can think of solutions which would, help them do more in a shorter time. The second phase is training. How do these people get trained? Do they really understand what's being given to them in terms of literature, right? So that's the second place where we feel AI can really help, because again, it's multimodal, multilingual. So you can train them in their language and you can voice train them, as opposed to asking them to read 100 pages of literature and saying, you get ready for this sort of test. See, and the third thing is really like understanding the ecosystem, like how, like their daily operations. It's very hard for us to sit in, let's say, a Delhi or a Bangalore and design a solution for them, right? So can we really spend time with them on the field? And this is the reason why we partner with local field organizations who are already at some scale working with these communities, because you cannot design a technology and not deploy it. You have to deploy it at some small scale and iterate on it to really build something that will work at scale. So these are a couple of things that we do.
Thank you, Tanvi. Jibu, what do you think are the top barriers in gaining trust, especially from maybe governments or also healthcare professionals and patients towards AI for health solutions? And according to you, how do we address it?
Yeah, so there is this interesting statistics. I think it was in this paper by Christopher Roberts and co in an article where they quoted that over 50% of Indian healthcare providers and workers are hesitant to fully trust AI recommendations without human oversight. And I agree with that, right? So, but it goes beyond, right? And there was a survey actually in US in 2020, which said that around 60% healthcare providers in US are skeptical about the accuracy of AI in clinical settings. Now, I don't blame them, because again, it goes back to, we have seen this snake oil salesman, like after seeing debacles such as Theranos, how do you believe any tech in healthcare, right? When you see this kind of things, even now, when somebody pitches to me, I'm someone who get a lot of conversations with upcoming startups, upcoming product launch, and people are pitching to me, oh, this is what we are doing, and you can sense it, right? How much, and how do you, so building trust has become a very difficult challenge. Now, one way you can do that is, one good example is Tata Memorial Center. They have how they use technologies, especially in diagnosing cancer. So they have this protocols to ensure transparency, right? And that by nature build trust among patients. Now, we are dealing with a space where trust between, forget technology, trust between doctor and patient is eroding by day, right? I see many folks who are in the hospital, when the doctor says something, they Google it and then they question it, right? And I have, like, my best friends are doctors. Like, I have a privilege that 3 of my best friends are doctors, and they come back and say, "Now this is what happening. ChatGPT told them to do this." Then I said, "Why don't you go and consult ChatGPT? Why are you coming to me?" Right? So that's one element, right? One element of this doctor-patient relationship. At the same time, while patients are comfortable in using technology, let's say WebMD, which tell you will die in the end, right? Anything will lead to your death, or tools like ChatGPT. When it comes to serious diagnostic tools, there is still hesitancy in accepting that, and a lot of that has to come to the fact that from time and time again, the industry or the startup community, not India, of course, the world has jumped to release these unfinished products or unbuilt tools, and that has eroded this trust, right? So, but if you want to build, yes, like I said, like I think Tanvi also mentioned, you need to build more awareness. We need to build more education on it, right? So that's one part. But at the same time, right, there is a part also ensure that all these tools and systems and technology that coming into the space, that there are less Theranos, but there are more QRAI or Nirma is coming into the space. So how do we ensure that? That's another question, right? Without that, we can't come and say, hey, trust us, right? Hey, trust my product. How can you say somebody to trust your product when there are a lot of, how do I say that? The cases like that.
Interesting. I think considering the disparity that exists in India, Tanvi, I'd like to know maybe if you have an example that of a project that you're implementing at People Plus AI, where you're trying to overcome the connectivity and technological infrastructure issues by leveraging innovative technologies. I know you gave a few examples earlier, but something that you're already doing in terms, and especially in challenging environments. So that'd be really helpful.
Yeah. So we do really two things. One is identify the use cases, population scale use cases where AI could be, that technology solution, which could really solve for that. The second is that, if you identify an AI solution and it has to scale, that means millions, hundreds of millions, billions, potentially AI transactions, right, have to happen. Then what kind of an ecosystem, infrastructure ecosystem is required for that? And see, it all really boils down to one of the major parts of this is compute. We covered data sets and the importance of that. But ultimately, all AI is compute, right? It's basically a lot of math happening on some very fancy, very high caliber machines, which basically means people need access to these machines to firstly build the product and then to deploy it at scale. So one of the challenges that we've seen is, again, even for some of our projects, apart from some of the functionalities that we are building out, we've often asked the question that, let's say you have, other partners who want to build functionality that we have sort of built or curated into their portfolio. A common challenge that comes out is, how is that going to run? Or where is that going to run? So one of our projects that we are heavily, talking to METI, discussing with providers of compute and customers of compute is called open cloud compute. Think of this as an open network. So if you're familiar with the ONDC approach, which is an open network for digital commerce, this is an open network for compute providers and compute infrastructure. And, very similar to the solar panel grid and the net metering concept, where anyone who can set up that capacity not only does it for themselves, but you can also now plug it back into the grid and offer it to others. You're basically adding capacity back to a larger grid. So the Open Cloud Compute Project, or OCC, is very similar. This is a grid where not only large data centers sitting inside India can plug in, but people who have micro or small compute capacity, edge compute capacity, sitting in, remote tier 2, 3, 4 geographies of India, they can basically connect to this grid, right? And provide it to the customers who need it. Because, see, in health, there are primarily three concerns. One is that data needs to be private. Data has to be sovereign. You want to keep it close to you. You want to keep it on your premises. And the third is latency. You need to give quick decisions, actions, results to people. So for all three reasons, this concept of edge computing and having a compute provider potentially close to you. And see, thanks to Moore's law and just hardware becoming so good today, it's possible for very small hardware to accommodate very high caliber AI workloads. So you would think that, the model of big server sitting in a big data center are the only model, but that's not true. So one of the people we are partnering with for this open cloud compute project is actually the former CTO of Cure. Because what we realized that Cure did really well was that the reason they've been able to deploy in these very hard geographies, not just in India, but also in Africa, is because they realized that, listen, compute is inaccessible, network connectivity is not always there. So we are going to package a hardware plus software compute solution and ship it to the end customer, to the hospital. They will put it there, they'll run the AI workload on it, and they'll get the results. So, so OCC is basically, we've got 24 technology partners right now for scale, all the way from Oracle Cloud Infrastructure to Neve Cloud to Vigyan Labs, which is a very, micro data center in Mysuru, to Shashank, who's the former CTO of Cure, who's actually started his own startup now to sell this compute hardware plus software solution. We've onboarded about 8 such players who are providing edge micro capacity. And some of these are operational models. They've been around for 3 years. they've been servicing not just national customers, but also international customers. So one way to enable health AI is to also put more effort behind OCC, so that tomorrow when you figure out that B2C or B2B app, which will really work for health, scaling for you as a builder of that app is not hard. You already, how we have STPI, your software technology parks, you could have a DCPI, you could have data center parks, micro parks, all plugged in, all secure, where if an AI application is there, it could run data on it, close to you. So that's really the work that we're doing at People Plus AI, not just at the functionality level, but also thinking through that in 3 years, 5 years, because see, this is coming, right? This is not we will have a solution and application tomorrow that will work very well. We already do, right? And for example, Cure's products are FDA cleared, right? FDA approved. There are products already like this that are available. The question becomes that if this product is available, why is it not reaching the people? How do we ensure that it gets deployed? And compute and OCC becomes one such effort to ensure that it really does get deployed and reaches really those underserved populations.
Super interesting. And I think that's so much important because, especially in the healthcare sector, last mile delivery and scalability is a major challenge, considering the sensitivity of the domain. So these things also comes with a lot of regulatory compliances in India, especially LMICs, where it's much more difficult to implement and reach remote areas. But I wish you all the best for it, and your team. Jibu, sure. Jibu, so you were leading the computing challenge for Mozilla Foundation. Why don't you educate us a bit on that? And also, what exactly were the aims? What problems were you solving for India? And where are we at for that?
Yes, RCC, Responsible Computing Challenge, is a very new initiative from Mozilla. So the idea is, how do we ensure that the next wave of technologies that comes out of our colleges, comes out of our research lab, are more socially responsible, and how do I say, and focus on human values fundamentally. So this program was initiated in the US a couple of years back. It was started by Kathy Farm, the former Obama advisor. And it was in US, I think universities like Harvard, Georgetown, Columbia, they were all participants of this program. Later on, it was expanded to Kenya and now to India. So we have a cohort of 9 participants, grantees here. So we provide a grant of collective grant of around $250,000 for universities and colleges, academic institute, who will look into creating curriculum or research projects that will incorporate, let's say, other elements to technological, like computer science education. For example, this year I think we have 9 grantees, including 2 IITs, one NIT, Ashoka University, and many more. So some of the grantees, one that's very close to healthcare is work of one of our grantees focusing on how do we redefine technology for people with disabilities. So we can speak about diagnostics and all the other components of healthcare, but that's a very marginalized group of people living in our community, right? So even though we don't have we have fallen far behind in building physical infrastructure for them. This particular project is how we can mitigate that by building digital infrastructure for people with disability, right? I mean, it all came up with when one of the PI itself, who is a person of a disability, was telling how difficult for her to even read CAPTCHA on a computer screen, right? And then you realize it's not meant for everyone, right, to go through this text and all. So that's one of the projects we are looking forward very much. There was a similar project happened in US with the University of Notre Dame, where they looked at senior citizens and their mental health and technology. So the idea is to have support research from a research level, from a graduate curriculum level, to build tools or to be aware of social challenges, but at the same time, hold on to the values that we all preach. So that's what we are doing. This first cohort we're just starting, and we'll be having another cohort in the coming year as well.
Very interesting. Now that you were talking about so many collaborators and partners, my last final topic is on strategy, collaboration, and partnerships. So, Jibu, you're a part of this initiative and also the OECD Working Party on AI governance and World Economic Forum's Global Future Council. So, what are your thoughts on multi-stakeholder collaboration in terms of coming together and achieving shared goals? And how do you think can collaboration really address these issues together? And do you
I
think one organization is enough, or what are your thoughts on this?
I think we can't achieve anything without the right collaboration, right? For example, one of the reasons behind when I was creating India AI, one of the motivation behind it was that phenomenal work is happening in silos, in academia, in startups, but they are existing in their own space. For example, I remember having this conversation with this professor from ISI Kolkata, Susmita Mitra. She's a very senior researcher. She's a very reputed researcher in the space of machine learning globally. So she and her team developed I think a COVID identification tool, and it's demoed well. It has a very impressive rate of accuracy. But then there was a question, Then I asked, what are you going to do next with this? Then I said, we don't know what to do next. We can only do as far as publishing a paper. That's one big challenge, right? So speaking of course, stakeholder collaboration, the industry academia partnership, we have a lot of work to do. I mean, it's improving, right? Especially with AI. You have Robert Bosch Center and Google's responsible AI Center in IIT Madras, or in IIT Bangalore, we have Kota Mahindra Center. Now it's all coming up, right? But it has to go much deeper than that. For example, we often look at like Germany, for an example, as a pioneer of innovation, right? Especially in terms of automobile engineering as well as healthcare, right? Now, if you go to the city of Erlangen, very boring city, absolutely boring. I hated every second I spent there. But they have two important things in Erlangen. Erlangen only has two important things. One is Frederick Alexander University, which is doing phenomenal work when it comes to AI and healthcare. And second, Siemens headquarters. So how this healthcare manufacturer Siemens and FHU, works in collaboration. How the students are, how do I say, encouraged to take projects in healthcare. That's a very good sort of how do I say, we learned it in we learned about lichens, right? I remember in our school days, right? How symbiosis happens between cyanobacteria and algae, right? Fungi. So that kind of sort of partnerships are there. It's the same thing, right? If you go to cities like Wolfsburg or anywhere, you will have universities, and then you have companies. Jan, of course, a Jan company working with them. We haven't had that, right? Secondly, I think biggest challenge I think you didn't bring out, but after going through the RCC effort, the bureaucracy. It's a big challenge. The red tape is a big challenge. I mean, even if it's to allocate a grant, the hoops you have to jump through. I mean, I have nothing. I mean, we need regulations. I'm all for regulations, but the office works, right? I know some of these universities are understaffed when it comes to bureaucracy, when it comes to all these things. But at the same time, right, there's a lot of burden on the researcher itself to do all the things, right? So that's another question, right? Why? So these are some of the process. How do we ensure that we create an environment where these projects are recognized and built? A very good model will be look at what DARPA has done in US for years, right? Take any brilliant technology we are using, whether it's internet or AI itself, right? The Dartmouth conference was organized by DARPA. So if India has to go beyond what we are, we need a layer like that, right? A layer which looks into research, a layer which bring other stakeholders, right? A layer which will bring industry partners into it. I think it was one of the early visions we had when we were thinking about India AI. So we need that kind of layer. Maybe PhixAi could become that layer, or any other organization can come that way. So that's where I think the how do I say, the success lies in my opinion.
Thank you, Jibu. Tanvi, what is that one piece of advice that you would give to startups and also NGOs or INGOs working in the realm to strengthen collaborations and partnerships in this space?
I would say talk to each other sooner. See, because the problem with health is that once you have a design, you need test beds to do both clinical design, market validation. Till you get real feedback from real users, you don't really get to something that will truly work and scale. So, and this is genuinely a challenge as well. We talk to a lot of startups today who have great products and early signs that this will help, the actual daily operation or outcome or whatever it is. The question is, how can we enable more such startups to not just build products, but actually deploy it some small scale? So I would encourage people who are in startups to find partner organizations of, people who are working on the field with your consumer persona, that customer persona, and to actually do this cycle of design iteration, learning, testing with them. Right? Don't work in a vacuum, don't work in isolation. Find the right partner and actually do it. And see, I truly believe that getting your product regulated or meeting a certain third party, let's say audit or technical standard or whatever it is, FDA cleared, approved, I know it's expensive, but adding a certification to your product only helps. So basically telling the consumer how your product's built, what you're using will only help in health, because really people need that confidence and providers do as well, right? For a provider to say that use this product with confidence, you need proof, you need validation, you need verification, right, of it. So I think I would say talk to more people as early as your idea is, run it by organizations maybe like ours, where we can connect you to other not-for-profits. And then if you're truly facing challenges where you feel policy will help, we often hear this from startups. Like we hear about data sets. How do I get the right data sets? And we hear about how do I find the right test setting? How do I reduce my sales cycle such that I can quickly get into, let's say, a large hospital and actually see if this helps or not? So if you are having such concerns, let's figure out a way how maybe policy advocacy can help you. Because till a few minds sit together, draft it, take it to a body, right, it anyway will not happen. So, don't purely just think market as a startup. Don't think you're alone. There are many, many builders like you out there who are asking for the same things. If somehow we can get the right consortium together, it'll only help the larger community thrive.
Really helpful. Thank you, Tanvi. Pallavi, would you want to take the questions? We just have 3 minutes. So how would you like to take this forward?
Thank you so much for this. I think we have about 6 questions with us. We can perhaps take, I think, 2 questions in consideration of time. So the first question that I think we could take up is, people want to know that what exactly do we mean by unified AI?
Jibu I think Jibu, Jibu can answer that.
Yeah.
Well, I don't know what was the context of that question. Unified AI. Maybe we speak about unified AI ecosystem, not unified AI. Maybe he might have heard that. Well, I think that's what I was reiterating, right? When things are sitting in their own silos, we don't get. For example, there is statistics. Collaborative AI projects in healthcare has shown like 20% increase in patient engagement, right? Even in India, right? If it's a collaborative project involving AI healthcare, for the project that has implemented have reduced things like patient wait times by 25% and things like that, right? So what we are saying is there the examples I mentioned, project sitting in universities, project sitting in with startups. Unified ecosystem means there should be an ability to share data, there should be ability to access data, there should be ability to share technology, the research. So that's what we meant by unified AI ecosystem rather than unified AI.
Great. Thank you so much, Jibu, for that. Our next question is around, data and biases that AI can have. So, how can we possibly build AI inclusive policies that can, build data without any biases? Do you think countries with, larger diasporas or, wealth inequities, can they enable such inclusive systems? Tanvi, would you like to take that?
No, I think they can. See, I think this again just goes back to, firstly, you need, when it comes to data, right? Firstly, as an operator, if you're using some data set, the more documentation you have around it, right? So when it comes to informed consent or creating a grievance redressal system, if you're truly collecting data from people, firstly, the more documentation and history and credibility you're building helps you as a builder, because let's say tomorrow something goes wrong. You would have shown that I put the right checks and balance in place at least. You can always, you only improve from there. Right. And see, of course, when it comes to the Indian diaspora and the various ways you can slice this pie, honestly, there is no end to how much data and how you collect it and in what all contexts. But it's a very simple sort of matrix, right? You have to start with high risk disease areas, high risk populations, where let's say if there is an AI tool which is giving an answer, I would say those, if you had to look at that risk and importance or criticality matrix, an XY sort of axis, high risk, high importance, right? And for those conditions, disease areas, populations, it would be best to have some kind of data governance or data regulation or some kind of guidance in place. And then you sort of move your way back, because you can't approach the entire diaspora at one go. You have to start somewhere. And any product development team will tell you that you're at any given point of time, you're minimizing risk, right? Especially in the health scenario. So yeah.
Great. Thank you so much, Tanvi, for that. I think in consideration of time, we can perhaps, wrap up. For all the other questions that we received, we will try to, get those answers out there to you. And once again, Jibu, Tanvi, Resham, thank you so much for, coming together and, sharing your views on, on emerging AI and technology. I absolutely loved how, despite, technology being the future, you guys still understand and, advocate for the importance of, things like human-centered design and how we need to, keep people at the center of, whether it is designing any interventions or, testing out any interventions or, even, when we talk about governance. So once again, thank you so much for that. And we hope you stay connected to the YO.DH community. Thank you so much. And thank you to all our participants for being here with us. Thank you.
Thank you, Pallavi.
Thank you, Pallavi. Thank you, Resham.
Thanks, Jibu.
Thank you.
Thanks, Tanvi.